Number 3, outside supply. This is the one most people are the most familiar with, so let's discuss it in the greatest detail. Medical doctors use this. Add. This means adding something to the body that we think it needs from the outside. That would be some sort of chemical, usually like a prescription drug, but it can also mean diet. Does anybody believe that diet is not important to health? Not many. So answer me this. How much training does your medical doctor get in school about diet? Answer: none to very little. Google their courses of study in med school and you'll see what I mean. See this book? It was written by Dr. Barry Sears, who has a PhD in biochemistry. It's his 4th book and his best effort to date. I've gone over every one of his books with a fine-tooth comb because I have a biochemical background. It tells how the body works chemically and, quite frankly, isn't afraid to discuss chemistry's shortcomings. It should be considered the Bible of chemical healing. Now, if you don't want to read this very relevant book, at least know this. Consider the food you eat at least as important to your health as you would prescription medication, because it is. Also, consider taking at least 3,000 milligrams of omega-3s daily. That's less than $2 a day for the pharmaceutical grade kind. That is assuming you are not on any blood thinners or have some condition that would preclude you from taking it. You know what that'll do? That will favorably tip the scales in your body towards less cancer, less strokes, better brain function, better heart health, and the production of natural anti-inflammatory substances in your body. It's been heavily researched. It works by favorably altering the eicosanoids in your body, the way your individual cells talk to one another. Omega-3s are as close as you can come to a home run, chemically speaking, and most people don't know how important it is. And you know this? It doesn't require a prescription. Now, you would think that a doctor who uses biochemistry all day long in their practices, like your medical doctor, would be fully aware of this and recommending this faithfully to their patients. But chances are they are not. Why? 2 reasons that I can see. 1, as previously discussed, they weren't taught a lot of nutrition in school. Number 2 is that it wouldn't make our current system of healthcare any money. In fact, it would hurt it immensely, and our pro-pharmaceutical press is not going to promote that. Think about this. We are only one of 2 countries in this world that allows drug advertisements on television. We didn't used to allow it for obvious reasons, but that all changed in the 1980s because there was just too much money to be made in it. The bottom line is that advertising works, or companies wouldn't be doing it. Our latest biochemical craze is cholesterol-lowering statins, an estimated $29 billion a year industry on one type of medication alone. We'll discuss these, among other things, in a later video called Standards of Care. You might just want to watch it. You see, there are forces at play that might not always be in your best interest. Now, is there ever a place for medicine, you ask? Why, of course there is. You just need to see medicine in its proper context, and then armed with better information, you can become an informed consumer. Does that sound good to you? Remove. This is where something is perceived to be harming the body and needs to be removed. Cancer surgery is a typical example. We'll talk more about surgeries in upcoming videos, but for now know this. The international medical community agrees that between 10 and 15% of the time, a surgical C-section is probably necessary for pregnancy. Do you think the International Midwives Association would have a lower figure? I do. But to make a point, let's continue. Let's just say, for the sake of argument, that the figure for C-sections should be around 10%. Would you be interested to know that the national average in this country is 33%, over 3 times higher than what is even recommended by the medical community? Is surgery, or for that matter, prescription drugs, an exact science? Surprise! Not even close. Have you ever wondered why they don't allow cameras in operating rooms? It's because mistakes can and do get made. Talk about opening up a can of worms, so let's not go there. We doctors are human after all, and there's nothing magical or mystical to it. Just ask any spouse of a physician if they are human like the rest of us. You would get an earful. You know, I will go on record today and predict that 100 years from now, heck, 30 years from now, we will not be performing nearly the number of surgeries that we do today. In fact, it's already beginning. Watch for my upcoming video on spinal surgery, as I have to deal with this in my practice all the time. There are things you might just want to know. Support. This will be a case where something is necessary to sustain life. Emergency care falls into this category, and it is one shining aspect that I'm grateful that we have. However, keep in mind that the principles of emergency care work poorly on the other 99% of our lives, or for that matter, on the diseases we are dying from today, or we wouldn't be dying from them. You see, it's the attention emergency care receives that makes us think it is making way more of a difference than it actually does in the bigger picture. But you couldn't make dozens of medical show dramas over the years without it. You see, we just love to watch life and death situations, don't we? The strengths of using things from the outside are that it can be sometimes a game changer if applied to the right person, at the right place, at the right time, the right age group, in the right quantity, to the right ethnicity or race. But herein lies the problem. As previously discussed, there is no simple black or white way that works for everyone. Just think, if you or I could ever figure out a way for chemicals or surgery to work for everyone without side effects, we would be gazillionaires. Eat your heart out, Bill Gates. Its weaknesses are that because using chemicals or performing surgery often achieves quick, dramatic effects in the body, it is easy to conclude that it is more important than it actually is. It also makes it more dangerous to our health, by the way. More on that later.